I would like to share my experience on scar tissue behavior and repair through dry needling. I've been training on myself and on my clients for more than 7 years as I'm a remedial therapist. Scar tissue affects the nature and the function of the tissue. So I will show you a few techniques which will help to repair the scar tissue and allow the new tissue, which is more functional, to regrow and regenerate. So just let's have a look on my finger here. I have a cut. I have a cut from an incision, and it's affecting the strength in the finger. If you observe this scar, we have to start treating on the edges first. So we have to identify the edge by feeling around the scar. So once you feel the scar tissue, which is more tough than the other part of the skin, that means that's the edge of the scar tissue. So we will target the edges and start needling over the edges, and gradually we'll see the changes happening in the finger and the surrounding areas, and then we can slowly and gradually go towards the center of the scar. So the basic side line or the basic fundamental line is to start from the edges. We don't want to create any more scars. We want to reduce the scar, so we have to target and enter the scar from the edges. Okay, I'm going to use a really fine needle, which is 0.20 into 30. You can buy these needles from eBay or online. You can buy them bulk, or you can just use a 10 packet like this. All you need is use 3 to 4 needles, and we are not trying to go too deep, so you probably won't see any blood coming out. Okay, so I'm just going to open this. I'm doing it on myself so that I can clearly explain. So I'm just going to use some alcohol swab and wipe this area. Now you can clearly see the edges of the scar. So we'll do needle 1 each, maybe 3 to 4 needles maximum. It all depends on the length of the scar. So we just locate the edge of the scar where the needle tip is, and we always divert the needle in an oblique angle so that it enters the scar. So if you go straight, it will actually pierce the normal tissue. So if you go oblique, then it can directly go towards the scar. So once you locate the area with the tip of the needle, then you can slowly, with the help of the guiding tube, you can just slowly push the needle into the scar. So when you get the needle in, you can actually feel the scar tissue is more painful than the surrounding areas. If you feel more pain, that's a good thing, especially with scar. That means you have entered the scar tissue. Same way, I'm also going to do the other edge of the scar. So once you locate the other edge, and then just go obliquely towards the scar. So this is how you place the needles towards the edge of the scar, and we'll leave it like this for about 10 minutes. In between, if you want, you can just keep moving the needles so that you get more blood supply towards that area. And also what you're doing is actually breaking the scar with the needle tip and hoping the body will replace the scar tissue with more live tissue, and which is more functional. I've tried needling on this scar quite a lot of times. It was really big scar. Now it's come down to this size, and I'll if there are more interests in this video, I'll update you about the progress of this scar in a later videos. So we'll do this for 10 minutes, and after 10 minutes we'll slowly take the needles out. And as you see, there is no blood coming out. We'll